Okay, all right. Okay, Assalamualaikum and a very good evening to everyone who is here in this Zoom today for the ANSARA Muda Career Talk Master Series with Dr. Fazir Omar with the topic today, which is cardiology. First and foremost, we apologize for the delay because we seem to have a little bit of a slow connection tonight. So first of all, before we start, I'll introduce our special guest for tonight. So Dr. Fazir Omar, of course, is the MRSM Taiping alumni, and he comes from class 408508 with the homeroom teacher, Cikgu Masuria, who is with us tonight. Besides being from class 8, he was also a librarian at MRSM Taiping, and he was also the head of tennis, where he represented Taiping as well. So you could say that Dr. Al-Fazir was a very holistic man himself. So after SPM, he did his Form 6 at Abacus College at Oxford, and later did his Bachelor of Medicine and Surgery at the University of Manchester in UK. So this is where he was the sports secretary of the Malaysian Society. So for anyone who is planning to go overseas, rest assured, usually there are Malaysian societies over there which you can participate and be active in. And after that, he obtained his MRCP, or other known as membership of the Royal Colleges of Physicians in London. Subsequently, he has many fellowships from various regions, such as Asian and the USA. Without further ado, I invite Dr. Al-Fazir to the screen.
Okay, thank you very much for the kind introduction. First of all, I'm very happy to see Cikgu Masuria here. It was a very pleasant surprise. She was our homeroom teacher, and she's still very active at Taiping. Oh, and also I was not the head of tennis. I was playing tennis, but I was not the head of tennis. Okay. Let me share my slides before I can share screen. Okay, can you see my slides? Okay, good. Okay, so today I'm going to talk about career in cardiology. Let me put my time here, takut over. Okay. So there are many specialties in medicine, so you need to know yourself. So kalau you want to do surgeon, psychiatry, GP, cardio, peds, there's a lot of fields of medicine. And you need to know that it's not always true because I'm not so intelligent, as Puan Masuria will tell you. Tapi bolehlah lepas jadi cardiologist. So you just need to know how to get into if you're really interested. So I think if you're passionate and interested, there's always a way to do it. Okay, but generally you need to know yourself too. So there's a lot of algorithms now, like if you like certain things, like if you like to work crazy hours, maybe like emergency medicine. If you don't like to talk to people, you might want to do anesthetics because you just put them to sleep. They don't know you. They don't know you after that surgery anyways. Some like to be in the front, so surgeons are quite forefront, and some likes to be very mentally challenged, so you might want to do physician or endocrinology. So for cardiology, I think you need very good hand and eye coordination. So sometimes when I do a case and patient will comment, ini macam main game je doktor. Tapi because that's what we do actually. I mean, we do a non-invasive operation, so we do from the hand or from the wrist. I'll show you what are the things that we do as an interventional cardiologist. And when we're done repairing the heart, all they have is a small scar in the hand. Okay? And they can go back home maybe the same day or the next day. So for cardiology, I think you need to be slightly enjoy adrenaline because especially interventional cardiology. I mean, there are days that you have ups and downs, so you really need to enjoy things. And it's a bit of a roller coaster ride, as in any profession. You'll be able to take the ups and downs in life. You enjoy your view at the top and smile when you go down. Okay, so that's very important as a doctor because you will have good days and you have bad days. So in medicine, number one, don't do it for financial gains because it's probably easier way than this. Tapi if you really need to know what the doctors makes in America, so there are different specialties, and of course everywhere is different, but that's generally roughly where cardio stand for now. But who knows, the future will change because of how the COVID world and the new MCOs and all that. And this is in, I think this is in France. So anyway, so that's how much they make in France with different specialties. So don't put money as a consideration. I think you need to put your interest first. However, if you still want to do cardiology, then you need, number one, to get good grades or fairly decent grade. So typically your SPM must be good, get all A's if you can. Okay. And then after that, you do your A levels or your matriculation. It depends on the graph. I mean, it used to be like you have to get 3 A's or 2 A's and 2 B's, but definitely some, if you go to UK, there are some that are more interested. So biology, you have to get an A, physics, chemistry, and mathematics. So that's the usual 3+1 subjects that you need to get either 3 A's and 1 B. Or you can do your STPM, or you can do your IBs. And your next challenge, actually the hardest challenge, is getting into the medical school. Kat Malaysia ni, quite a lot of medical school. You have the universities like PPUM, UKM, USM. You have the international, the private schools here also. If you talk about UK, that's where it gets the bottleneck because not because they don't really offer that many space for foreign students. So that's where your academic and your curriculum really needs to stand out. So if you want to apply to anywhere later on, make sure that number one, you get good grades because that's your requirement. But everybody who apply will have good grades. So you need to have good co-curriculum activities to make you stand out. Then we'll talk about how to get a good job, because that's also difficult because once you graduate, everybody graduates with the same baseline. So how do you get into a good job? And you have to pass your exams. It never ends because you have to pass from your medical school to your specialty exams and all that. So it's a long procedure, but I think it's a very fulfilling journey. So education pathway, you do your SPM or your O levels, then you do your pre-university, your matriculation, your foundation, then you do your degree. Normally takes 5 years, some 6 years. You do your houseman. Houseman takes 1 or 2 years. Then you become a medical officer. That's when you do your exams. You do your MRCP exams if you want to do your membership, or you do your Masters of Medicine in Malaysia. You apply to universities like HUKM, PPUM, USM. And then once you get your entrance exam, your medicine entrance exam, where you qualified as an internal physician or general physician, you can then apply to do cardiology. Cardiology is another 4 years in Malaysia to get your certificate as a qualified cardiologist or a specialist. Okay, so step-by-step approach, you graduate, then you become a houseman, although sometimes now I hear that there's a bit of a delay in getting your first job. MRCP, and if MRCP, after you graduate, you do your MRCP, and it usually takes 4 years because there's a theoretical exams, there's practical exams. The passing rate is about 50% every time. Or you have your master's program like we discussed. And then in Malaysia, you need some gazettement period, which can last a few months to 18 months. And then you're qualified as internal medicine or general physician. And then if you want to do cardiology, you apply to do Masters of Medicine, and you do your, you can go to Ministry of Health, or KKM. So now the main base is in Sedang Hospital. They've got really good technology and devices, machines there. You have Penang, Johor, Sabah, and Sarawak. You can also approach to the universities. You can become associate professors. One of our classmates, Puan Masuria Sazli, is now one of the directors of new hospital in Sungai Buloh in UITM. and also IGN. So IGN is where I went. So after after I work in UK, I went straight back to IGN 2007. So usually this takes about 4 years. In UK, about 5 years. You have a logbook. So the logbook, you have your patients to, basically you have to show what you have done. So you patients, or you record the tests that you do, like ECGs, echoes, stress tests. And we have a number of procedures that you have to show you have done and competent: pacemakers, angiograms, angioplasty, pericardiocentesis, and all that. All right. So tips to get good medical school or jobs. So one of the things that has stood well for me is that you always plan and learn of your immediate, the role of your immediate senior colleague. That means when I was a houseman, I tried to improve my responsibility roles by behaving like a senior medical officer. And when I was a medical officer, I tried to take some responsibility as your specialist. So because if you show competency at that level, then they have no issues with promoting you to the next level. So always try to not be in your level, but try to be a step ahead so that your pathway is easier. In Malaysia and also in UK, it's always very competitive, and cardiology is a really competitive field. So apply hospital experience. So when I was doing A-levels and university as first year, I went to a few hospitals to do my hospital posting. So maybe 2 weeks, 3 weeks, so I can put that in my CV, what I've done during my holidays or summer holidays. So when I decided to do cardiology in my 3rd year medical school, everything I did was geared towards cardiology. So my cardiology, we did a thesis during my 4th year medical school on angina or the heart. The final year, I came back to Malaysia to do my attachment in IGN. So I came back as a student in 2001 for 1 month plus. And when I reapplied in 2007, they remembered, said, oh, you come back. So it's so easy, and everything is planned. You know? Alhamdulillah, things went well. And of course, you need to do a lot of research, and presentations will help. And I find that the most difficult time in UK was to get a job, a good job, because you suddenly have 300, 500 graduates looking for a job, and everyone is hungry for a good job. Nobody wants to work a bad job, right? So I remember applying 50 applications, hantar kat mail, Royal Mail to London. Out of 50, you get maybe 2 replies saying you have an interview and all that. So you just need to persevere with job applications, and inshallah one day you'll get it. Research is very important. So we did a lot of research, when I was in US. So we published a lot of things and abstracts. And if you are able to publish something as a medical student or even as a houseman, that will go very far, because that will differentiate you to your other colleagues that are applying for jobs. So in America, research is everything, because without data, then we're just doing things repetitively. All right. So a bit about me and my life. MRSM typing. So I had a wonderful 2 years in MRSM. My home teacher called Masuria Darus. It's an eye opener for me to be in MRSM and to mix around with, everyone of different backgrounds. Now after SPM, we were lucky. We were sent to Becker's College, Oxford, to pursue medicine or A-levels. Then I went to Manchester, graduated in 2002, and then worked my way. I did Cardiff for 2 years, then London, and stayed in London at Royal Brompton and Royal Surrey. That was all pure cardiology jobs. So my next role will be to continue my specialization in UK. But I wrote an email to to IGN, to Rosalie and Tan Sri Rabaya, and said, I would like to come back to start serving in the country, because I know we were under scholarship, and I didn't feel like, because if I pursue my further career in cardiology in London, I think it will be very hard for me to come back, because your whole life is built in around UK. So I had to resign my job. I had to give a letter to my boss in London and say, I want to go back. He was like, why you want to go back? So I had to resign. My wife, she was an engineer, and she also had to resign. She's got a job in London at the time. She's in Thames Water. She also had to resign, and we came back 2007, we came back. And that was my training in IJN, Institute Jantung Negara, which is very good. And we had very busy. And after that, I also did my fellowship in America. So this was our first house in Oxford. It's Lawrence Road in Cowley, and there was a lot of, it's all Mara students and MRSM. And some went to London, Ireland, and so forth. So all of us are doctors in here, and some remain in UK as well. So this was Manchester, and then I work in Royal Brompton in London for cardiology. Then, like I said, you need to publish papers like in UK, you know, or in overseas, is everything you need to publish in good journals. So that's what we did, a lot of work. And then I came back to IJN. IJN was hard work. You know, we used to have dinner and we come back home like 2 in the morning, or sometimes when I'm tired, I just stay in the hospital. So I will call up the ward and says, "Ada bed kosong tak?" Then they say ada. So then we just sleep in the one of the rooms there. So in our office we have toothbrush, baju, everything lah, toilet, towels, so that's where and so that's a good, you know, a friendship that we have in IJN. And then we did a lot of stuff. We did huge stuff in IJN. We did live cases to Singapore, to Europe, and so forth. That was very good, superb experience and friendship. And we gave a lot of talks around the world. Alhamdulillah, we had the opportunity. So we were in Paris. So this was EuroPCR, one of the biggest cardiology conference in the world now. This was our meetings in Singapore, and they're all cardiologists. So it was fun. I mean, you have friendship around the world. This was meeting another fellow Malaysian, Dr. Raj, he's in Kedah now, and he presented a paper in Washington. This was during my fellowship, and we presented our data in San Francisco. This was me presenting our Malaysian data for heart attack in Washington, DC a few years ago. And also we involve a lot of teaching. So one thing about medicine is that you never stop learning, you never stop sharing. So that was really nice. So this is Japan, in Hokkaido. And then I went to a hospital in Kedah to do some cases there. And this was my fellowship year, so I really enjoyed that. Initially, I didn't want to do fellowship because it takes a year out, but I brought my family. So my family joined me in Washington. So these are all doctors, and in America was amazing. It was an amazing time. I gave a talk in San Francisco about coronary stents. And the guy that's sitting here, he is one of the founders of Coronary Stent. So I was so nervous, like talking about something that this guy founded, you know. So being in America is truly an eye-opener, and I would advise anyone to go and have experience in other countries, because it really opens up your mind and your eyes, and also friendship. This is us, my kids is in Washington, DC, with the diplomats. He's now a big man in MIT, my friend, Hyril. This was Raya in Washington, DC. Okay, and also life-wise, like I said, never stop learning. So these are doctors from Harapan Kita, Jakarta. So we have good friends around the region. We share, even till today, WhatsApp. Dr. Donny Firman on my right there is the boss of Harapan Kita. He WhatsApp to me. He says, "Dr. Fazir, congratulations for giving a talk today on cardiology." So we remain close friends. And we work everywhere. This scribble that the Japanese doctor shared, I kept it in my office, because everything, there's so much learning involved, so much around the world. The world has become a small place now. I mean, you know, we can have meetings with people from America for free because of these webinars now. So I do cases abroad as well, alhamdulillah. So I do my case in Brunei. So I'm registered to do a case in Brunei. I go there when they call me, when I can fly. And I also do case in Vietnam as well. So this was in Ho Chi Minh City, when we do cases there. This is a beautiful place called Hoi An in Vietnam. Beautiful. And some of the hospitals that I go are really small and really scary, because you're like nowhere. And this was somewhere off Da Nang. So it's Da Nang, and we were like 100 kilometers off Da Nang. I don't know where they put me. So I was with the doctors here, although I look like Vietnamese, but you know, so I was Malaysian there. And this is Ho Chi Minh. So this also is a Tang Duc hospital in Ho Chi Minh, where we do cases and we have fun. Okay. So one thing about many of life's failure, and I think this is true, is that people, when you give up and you stop doing something, you do not realize how close they are to success. So sometimes, if you feel like giving up, always try to persevere, because it's not that far away. It's not that difficult. Seriously. So then I got my Sky membership in America, in Las Vegas. So although we have serious stuff, we also have fun stuff as well. So when we go for meetings, we go to all this shooting range and all that America has. Okay, medicine is not a 9-to-5 job, so you need to understand that. Or maybe some specialties, it's 9 to 5, but not cardiology, as you know. So this is me today. I was supposed to have to prepare my talk earlier, but I had an emergency case today from 1 to 2 o'clock, and another case at 3 to 8, 12 to 6 o'clock. This is a new world now when you have plastic sheets and you'll be covered by things to prevent you from getting any infection. But alhamdulillah, both of them are doing very well in hospital now. So in life as a doctor, when you're on call and the phone rings, this is how we look like. Because in cardiology, you have to rush to hospital when they have a heart attack. And I don't like when they call me at 3 in the morning, because the next day I'll be very tired. And this is also another, if you're a partner of a doctor, and they call you and say, I can't, I'm on call. This is a very common thing that we tell our friends, tak boleh lah today, on call. So I think that cardiology is a demanding but equally rewarding field of medicine. Unfortunately, your time is not yours. There are many examples. This one, I was in Janda Baik during Christmas, but every day I was in KL. On Thursday, I had a case. On Friday, see patients. On Saturday, patient's wife called me at 7 o'clock saying got chest pain. So drove back to KL, finished at 4 p.m. and then drove back to Janda Baik. So there was not much holiday left after all this. So cardiology is a field where you have general cardiology, you have preventive cardiology, you have interventional cardiology where you can do things like a plumber or carpenter with the structural heart. You have an electrophysiologist, an electrician, and you have pediatric cardiology. So that's why I like cardiology. I love cardiology because it's got so many things to do. It's a nice balance between what you know and what you can do. It's a nice balance of what you know in your head and what you can do with your hands as well. So that's quite fulfilling. All professions make a difference to a patient's life, but cardiology, you have an immediate difference. When they come in with a heart attack or they collapse, you can do something, and it's so nice to see that the next day they are talking and all that. So it's a very fulfilling career. It's so much evidence in cardiology. It's crazy. I mean, there's so many knowledge out there, and it's a very exciting field. Okay, so let me show you a case. A patient collapsed. He's like 82 years old. So we will bring them into our OT, or we call it a cath lab. Okay, so this is what we do. And when we say an angiogram, because he got a heart attack, so an angiogram is this, and they tend to have like blockages. So you can see the heart is a bit narrowed. Okay, what we do typically is that we will put a wire across, and we will dilate the blockage with a balloon, and later on we'll put in a coronary stent to keep it open. So a coronary stent is like a scaffold to keep it open and allows the blood flow to flow better. So it's a very immediate process, and patients feel better and hopefully alive as well. This is the stent we put. So this is a drug-eluting stent we put in the heart. So everything is done through the hand or the wrist or the groin. Okay. So this is another schematic of angiogram. We take pictures of the heart, and if there's a narrowing there, we dilate it, and then we can put a stent and leave it open. But this is a guy, he's 80-something years old. He collapsed, heart stopped 3 times. And the right side, you can see there's blood. The black color is the blood in the heart, it's fine. And here you can see it's completely blocked. The blood flow just went a bit and stopped. Okay, so he's got a heart attack, he's collapsed, heart's not happy. What we do is we put in a wire down to get the blood going again. We tend to suck out the blood, and then this is the clot that causes the blockage or heart attack. And then we balloon the blockage and we put in a stent. So now you can see the blood flowing back again. Just now it was blocked. And then when we put in the stent, the blood flows back again. So within half an hour, the blood comes back to your heart, and hopefully he feels better and can be discharged. So he this guy, well, so-called died 3 times, heart stopped 3 times. We revived him, and the blood flow is better. He's very well. He's from somewhere. He's like 80 plus years old, did well and very well. And he's in the clinic now, and he's like, super healthy. Another patient, 4 in the morning, and you can see the heart stop. The lungs are full of fluids. So this is when we call your heart failure. So your heart is not pumping and water builds up in your lungs. So this guy, he was really bad shape, like 4 in the morning. So we did a stenting and all that. And he did very well. I mean, he was in the ICCU for a few days, and the clinic-wise, we saw him back, he's doing very well. So it's always very fulfilling when you see this, okay? So this is your heart. So your heart is like your engine. And you have the red colors are your arteries, supplies blood, supplies oxygen. So when you have a thrombus or a blood clot, this is how it looks like. So it blocks the blood flow. You get chest pains or angina. Chest pain is like get on your left side, and we do it and we open up your heart straight away. Okay. So types of heart disease. So the one that we do, our bread and butter, is a coronary artery disease where you have blockage. You also have valve disease. So our jantungnya ada injak because it allows your blood to flow in one direction. Kalau tak, when your heart pumps, it goes forward and backwards. But there are also valve disease. And the valve disease have traditionally been an open heart surgery. So common confusion is cardiologist does small operations and the cardiothoracic surgeons does the big operation, the break up, do a major one. So we do the finer surgeries. You also have electrical problems called cardiac arrhythmias, where you have palpitation. You have heart failure, where your heart is not pumping very well, and so forth. So there are many fields. Cardiology, and also you have congenital heart disease. So my next door neighbor here is Datuk Hamdan. He is the pediatric and adult surgeon that does both. Okay, so our bread and butter work, preventive, is of course blood pressure. We do your blood test, we do your stress test. So this is to check your heart. If you have any chest pain, do your stress test. Make sure once a year, check your heart. Okay, and make sure it's okay. So this is stress test, and this is an echo. So an echo is like a baby scan but this is a baby scan for your heart. So it's an ultrasound of your heart to see how's your heart pumping. Kalau your injab is or your valve ada bocor ke apa, you can do an echo. It's a non-invasive test. So this is an echo lah. Okay. Stress echo, another form of stress test, and a CT scan, in which it's a very accurate way to check for blockages. So I kind of like CT scan nowadays because patients also demand, in a way, people don't like errors and mistakes. So CT scan is a very accurate way to check your heart. And this is your blood vessels. The A is normal and B is abnormal. So when you do a CT scan, we can know your heart in detail, and we can tell if you have 10%, 30%, 50%. So, and of course, we don't do this for everybody because there's radiation, but the radiation doses are quite low nowadays with the newer CT scan machines that we have. So I've done mine that way. So it's a good test to check. Treatment-wise, so there's a lot of things that we can do. This might make it interesting. So a bypass for cardiothoracic surgeons, they do a bypass. Bypass means in Malay, pintasan. So they create a new blood vessel. They take it from your veins, from your legs, and make a new highway. For us, stenting we do, so we put in wires and balloons to make the flow better for your blood flows. There's many devices that we use nowadays to open up your heart. So this is a device that if it's really keras or calcified, we can actually drill your heart. So the drill is made out of diamonds and it goes really fast and it breaks up the blockages. So there are ways to make you feel better. There's also pacemakers. So pacemaker is like rentak jantung. So if your heart is beating very slow, and typically elderlies, then there's a way to implant a pacemaker to make sure that your heart keeps beating. Also, the electrical doctors or electrophysiologists. So electrophysiologist is not it's still a growing new field. There's not that many in Malaysia, but it's growing. So I think about 10 now, or 10 or more, where they look at your heart activities and try and correct your heart palpitations, okay? This is the newest thing in the cardiology, interventional cardiology field, is the valve. So before this, valve used to be open heart surgery. So this is the valve, and the valve is narrowed. So typically you used to have an open heart surgery for your valve. You have to open up your chest. But nowadays we can do things from your small arteries as well. So it's something that we can do from your leg. And it's of course expensive, but it will get cheaper in time. But it's really non-invasive. Tak perlu crack your chest open, and so this one is done through your leg. So this is the actual valve that we can implant through your kaki. And the mitral clips also, kalau injak yang bocor, then we can. So this was how it was traditionally. You have to do an open heart mitral valve repair to correct your injak yang bocor. But nowadays there's also a system where we can clip your valve to correct this. So it's a very interesting field. I mean, there's so much technology involved in cardiology that it's interesting. And also, there are newer devices that you can see inside your heart. So angiogram ni tu macam black and white, so you can't see very well. So there are intravascular ultrasound that we see inside your heart. So that means with this machine and with the angiogram, we can see your saluran darah. So whether they are the plaque ke, ada any blockage ke, we can assess your heart. OCT is another very canggih, very sophisticated machine that we can see inside your heart, and we can see how the stent looks like inside your heart. So it's really amazing. Okay, I mean, it's like so high sci-fi stuff. Also, my last few slides, because I think we've got 9:40 now. So, my adventures takes us everywhere, and it's very so. Besides doing your career, make sure that you keep your friendship. I don't have that many pictures in MRSM because dulu tak ada iPhone, so all the pictures are quite new. This was my IGN day, so we used to do a lot of cycling. So we love our cycling everywhere. So we used to, and what we do is that we cycle, and in between our cycle, we'll give talks. So we'll give talks to the masjid lah. We give talks to the market in where we give a talk in Kundasang and all that. So we used to go about 130 kilometers a day. This was in 2017. So we did like, well, Sabah lah, you know, it was really fun. It's really scary. It's really tiring, you know, but it was very nice. And then last 2018, we went to Italy, but this one, that one no talks lah, that one just holiday and jalan-jalan. So this was the cycling group that we have. This is a place called Dolomites, northern Italy. And we brought our bicycle from Malaysia, and it was a fantastic trip. I mean, it's so memorable, beautiful, highly recommended. Also this, and also friendship-wise, so no matter how far you go in life, you please remember who you are and where you came from. So this was our Silver Jubilee celebration. So it's our classmates for 08 and 508. So the guy next to me is Sazli, and we were deskmates. And he's also a cardiologist. So me and him are two cardiologists in ANSARA Taiping, and we were deskmates. How freaky is that? So and all the others are doing very well. They won the call as well. So and Silver Jubilee. So we had a big celebration. I think it was 2 years ago now. So yeah. So please don't. Yeah. So keep your friendship. Keep your friends close. And then so in. My last slide is that I think if you do what you love, then hopefully you'll never need to work a day in your life. I hope you believe that. So anyway, so thank you very much. I'm in CVS now, and let me stop sharing my slides. Okay.
All right, thank you so much, Dr. Fazir. Thank you. All right, so now we're going to the Q&A session. To encourage, we do encourage more questions coming from the chat box from Zoom and also from Facebook Live. So please just drop in your comments or questions through the chat box or the question section. Okay, so the first question we have is during specialty training for subspecialists, how is the module? Like, for example, are there only classes or on-job training as well? And are there any differences with local modules?
So when you're talking about subspecialty, is it?
Yes.
So I think when you do cardiology, in general, you will have to go through all, well, there's adult and pediatric. Okay, so you're talking about adult, because that's where I am. So you will go generally the whole adult module. So there is, you should be able to go into a rotation where you do the general stuff, you do the interventional stuff, hopefully you do some structural stuff, some electrophysiology. So you do a general module, and that's the same now in Malaysia as in UK as well. So what you want to do is you have a general field of cardiology, and typically your final year of your training, you would then sub-specialize. So the sub-specializations are depending on the availability, the national country's requirement, and also your ability as well, because there is probably 1 or 2 places for this kind of training. So you need to have interest, and that's where I think that not only having good hands if you want to do surgery and all that, but you need to show research, because research, I think, is key. Because when you do research, number one, you differentiate among your colleagues. Number two, and I realized that when you do your paper, you really have to read up on all the other papers, and then your knowledge becomes from this little to this much, and once because you write discussion and all that, and when you write a paper, and if it's a good paper, suddenly you'll get emails from Italy, you get emails from Mayo Clinic to say that, oh, that's a very interesting finding. So can you imagine? And in America, and what I didn't realize in America is that if you think we are kiasu, or if you think Singaporeans are kiasu, the Americans are more kiasu. There were emails coming in and out from the top guys in New York at 3 in the morning. 3 in the morning. So because when I come to work at like 8 o'clock and I say, oh my God, 3 in the morning, they're like flying emails coming in and out. So that is how hard they work for your specialty. So America's an eye-opener. It's a bit stressful there, but they work really hard. So I think, if you want anything, you have to work hard for it. So yeah, so once they recognize you have the ability, then you do your 1 year abroad or local. And that's where you can do your interventional, your structural, your electrical stuff. So that's how it is.
All right. I hope that answers your question. And then, we have, I think this is your buddy in cycling. I'm not sure. Taufik. Do you still cycle a lot?
Yeah, Taufik is, I think he was in America at the time. I mean, he was in Washington, D.C. But I think now he's back. He's like one of the key guys in MRSM type, ANSARA now. Well done, guy. But he used to, So we were in DC at the same time. We cycled. I remember one day we cycled and we saw the temperature in the car was 3 degrees Celsius. I said, oh God. It was a pumpkin ride during Halloween. So, so it was fun. Actually, I got and Puan Masura is asking to me privately, but I think it's a good question. So she said that I would like to ask your experience as a 5th year medical student at IJN. What actually do you do there as a medical student? Any procedures you were in charge, or was there any specific jobs you needed to do there? Well, I think my attachment there was mostly to observe what they are doing, and to actually, wherever you go, you want to capture what they are thinking. So, of course, because I'm not a doctor yet, I can't be doing things on patients, but you can see their train of thoughts. You can learn from what they're thinking and where is it going. So I remember one of the guys that used to tell me, the future is cardiology, interventional cardiology. Then you get so interested and excited. And I think the best thing any medical student would do when you do your elective, like I say, is to do publication, because anybody can say I've done 1,000 angiogram. Anybody can say I've done all these numbers, but not many people can publish and cite their own citation, because once it's published, it has to go through a peer review, and it's, you know, so once you are able to publish as a medical student, you are above many other people. So also the connection and the network you have, and that's very important for you in your future. Because when in 2007, when I emailed to IGN, they knew me. They just knew like, oh, you were here many years ago, and we know you come back now. So it was that easy. It was like, so I think if you show your interest early enough, then maybe more doors will open for you.
Very true, very true. Okay, so another question. Would like to ask on how the overseas opportunities came about. Yes.
How about China?
How the overseas opportunities came about. I think she's asking from perspective of after SPM and also you getting a job there.
Okay lah. So after SPM was, well, terima kasih kepada Mara for sponsoring me to college because I can't afford it. So number one is, of course, financially, you need to be able to either get a scholarship or you have to pay. But from your part, number one is you got to get good grades because when you go abroad, you are no longer your competitors are no longer your friend next door. Your competitors are worldwide. When you go to UK, when you go to America, there are people next door. They are from China. They are from Hong Kong. They are from America. So things gets a bit more tougher. So you need to really show why you deserve a place in that medical school. And there are a lot of people smarter than me. So you need to be able to show that why you deserve to go through and be a doctor. So you need to show them like what kind of personality you have, what kind of passion you have, and all those. So when you have passion in something, I think it's quite visible and people can see that. So getting grades are one thing. Getting doing your research, getting your some people do not know what they want to do until quite late. So maybe it's not easy. I mean, some people know very early and some people don't. But once I mean, some people are happy being a general physician, a general practitioner. So it doesn't mean that you have to be you have to go to a very tough specialty, but it's something that is within you, is what you like to do. And I think if you choose a specialty that what you like to do, I think it's always, like I said, doors will open for you when you have interest in that subject.
On that point, actually, I noticed like from your explanation, you figured out you wanted to be a cardiologist quite early on, right? Could you maybe like share with us like how did you get that clarity quite so early?
I mean, for me, I like to do, okay, there was a time where I was also interested in neurology because neurology is very interesting because neurology is like, it's all about patterns. You have this certain A plus B plus C plus D equals to this diagnosis, okay? Very interesting, but at that time, like, there was not many treatments available as well. So cardiology was a really nice mix of theoretical knowledge and what you can do. So that's very fulfilling. But there are other people who likes to do other stuff. I mean, I'm always a few months ago, we were seeing a patient. She's a GP and she is in stage cancer patient. And so I spoke to my other colleague who's an oncologist and who's also a palliative care. So they treat cancer patients. I say, I don't know how you do this. I mean, it's so heavy. I mean, you see this patient who's young and who's got cancer. So, but to him, that's his calling. So so I don't know. I can't explain it, but it depends on what you feel that you want to do. So for me, I like the mix of hands-on and knowledge-wise. And that's what I did. I mean, when I went to IGN, it further cemented my interest in cardiology. So you have to not only have interest, but pursue that. If it's not then I also went to do an A&E. So I split my final year. I went to 1 month class in IGEN and another 1 month in A&E because I quite like A&E as well. But when I went to A&E, I felt that that's not for me because there was not much continuity because you see patients, you treat and then they go off to the wards. Whereas cardiology, you see from door and discharge and follow up. So I like that.
I see. So you could say that for you to decide that you really wanted to do cardiology, you had to actively explore your options, right? Okay.
Well said.
All right. So another question coming from Khairunisa. Doktor susah tak nak dapat kerjaya sebagai cardiologist? And I think maybe you could say in the context of Malaysia and also I think Malaysia would be a good basis. And berapa lama kena belajar? I guess in total lah kot.
Okay. So cardiology, I mean, any specialty can be a bit difficult. And really, even for me, and I think everyone, when you're doing your training and your exams, at certain point of your career, you rasa like, oh, bila nak habis ni? You know, there are times that it's just so painful because exams after exams, and you might fail one paper, then you have to resit another paper, you know, but so memang susah, but I think any specialty is difficult. And especially, you know, when you get married lah, then you get kids, you know, then you have to work. After work, you have to belajar, you know. So it's not easy. But if that is what you want to do, then you have to be focused. I mean, like I said, I mean, you know, sometimes when you want to give up, you don't realize how close it is for you to achieve that, what you want. So just persevere and put in effort. Because, you know, and you're right, I think if you enjoy something, you put in effort, then, you know, nothing is that difficult. You try your best. So memang susah, I think all is susah. Berapa lama kena belajar? Lama lah. You know, it's lama lah. I mean, medical school like 5 years and then 4 years of MO plus MRCP. So that's 9 years. And then after that further. But like I said, if you enjoy it, then it's not a work anymore. I mean, it's a calling, it's a responsibility, it's something that you enjoy doing. Like today, I'm here in my office, and I remember there was one day I had to give a talk to India, and it was at 10 o'clock at night because in India, so I had to be here until 11 o'clock at night talking to India. But I was like thinking, oh God, I mean, it's like 11 o'clock at night giving a talk to India. So it's not easy, but it's something that you want, that you have to work for it.
All right, Khairunisa, I hope that answers your question. For Khairunisa and previous other persons who have asked questions, if you want to have a continuous question, just please do put in the chat box. All right, so from Aina Isayani, now the medical course is very small, Ken. So how can I get any scholarships to study in this field? Because I'm very interested in medical course. I think in general, you sort of covered how to get a scholarship, right?
Yeah, scholarship is very difficult nowadays, but I mean, there are still scholarships available, you know, and there is. I mean, there is still, but you really have to excel. I mean, there are like Chevening and all those. There are also still, I mean, medical school is tough, but you know what? Post-medical school are easier now. So say that you do a local university, if you can't, you know, it's not easy to study abroad nowadays, mahal and also very competitive. I find that one of your easier route to go abroad or to study abroad is postgraduate. You know, because Mat Saleh ni, I should say this, but they don't like postgraduate so much. So the undergraduate is very full because they tend to become GPs and all that. So, but when you want to do a specialization and all that, it's slightly less because so like, you know, even if you're not doctors, you want to do like masters and PhDs, that's actually a very nice route for you to go abroad. Because like I did my fellowship in America, and I've never been to America as my undergrad as a student, and I find that I learned a lot in my 1 year there. I mean, so even if you are studying in Malaysia in medical school, number one, you can always do an attachment for 1 month when you're doing your holidays to go to America. There are many people in America that works for free. There are so many Mexican doctors, Colombian doctors, and they are doing a lot of work, like research work, but for free. All they want is just a CV and their experience. So You go to America for 1 month, apply online, send an email to the doctors there and say, like, I'd like to be there for 1 month as a shadow and all that. So, and when you do your PhD, and one thing good about America, they know how to attract, and retain talent. So if you're good in America, before you finish your PhD, they will say, why don't you come and work here for 2 more years? So that's what they will do, because they got a lot of money. They'll give you grants. So that is your way in if you can't go there as an undergrad. Undergrad is quite tough. I mean, if you can, that's great. But I mean, if you can't, don't stop there. You apply later. Maybe the other tip that I did not do myself is do a USMLE. USMLE is your ability to do your hands-on in America. So USMLE is very similar to medical school exams. You can do it on your own time, and better you do it when you just graduate, because that time you're still very fresh. Get it out of the way, because once you have USMLE, you can actually it's like a license for you to practice. So you can open your options to work in America if you want to.
Is this USMLE also applicable in Malaysia?
Yeah, it's just an exam that you do online or something. So so a lot of British that wants to work in America, when they graduate medical school, they will also do their USMLE exam. There's like part 1, part 2, and all that. So that gives you more options to do.
All right, I hope that answers your question, Aina. Okay, so we have a question, a personal question, I guess. How was your life after being a cardiologist?
I got no life. No,
but your is your career,
actually, so I think as a doctor, you need to learn to switch off. And Taufik knows this, that I love cycling. Cycling is my switch off button. So I cycle in the morning, I cycle at night, because that allows me to switch off and go for holidays with the family as well. So you need to know, because if you don't switch off, then things can pile up and all that. And like my roller coaster slide, I mean, you have good days, you have bad days. When the thing about cardiology is that things goes wrong, it goes wrong really fast. Like their blood pressure can go from normal 120, 130 to down to no blood pressure in 20 seconds. So you really need to be composed. You need to know what to do, and you need to be very analytical. So you do step 1, this, step 2, step 3, step 4. I mean, but the moment you come back home, you switch off. You're like, okay, that's done. Keys off, and then you enjoy. So I enjoy my life, alhamdulillah. I mean, Taufik knows it. I cycle a lot. Cycle in the rain, cycle there, cycle here. But now cannot cycle abroad, So
pandemic and all.
Yeah.
Okay, so practically just learn how to balance your life in between your work and also your personal. All right, so from Aina again, how to be a doctor outside our country, as we don't hire many new doctors. I think she's asking regarding application for being a doctor in overseas.
Yeah, okay, that's a good question. Okay, the good news is that most Malaysian degrees is recognized abroad. Okay, and the good news is that you can publish anything in the world in your bedroom. So if you have good data as a medical school, you can publish this data. And when you apply for a job in America or in Europe or in Australia, and they say, hey, you publish in our Australian journal, or you publish in our JAG journal in America. And so it takes you, they recognize that, you are actually more of an international, at the different ballpark, because like UK, I mean, they've come out from EU, they're going to be a vacancy in jobs as well. So the good news is that, yes, we are recognized. I think local degrees are recognized abroad. But I say that is the hardest field, the hardest entry, because everybody is the same graduate. But I think you can apply. And like I said, I mean, try and do some research. I mean, because you can publish in any journal in the world from your bedroom, and they recognize New England Journal, all this big journal circulation and all this. So if you publish in this journal as a medical student, and I can tell you a story, one of the doctors in my fellowship, he presented in the American Cardiac Society as a medical student. You know, it took me like how many years? It took me like 8 years after graduation to talk to them. He presented in the American Cardiac Society as a medical student, and even when I was in America, they talk about him. So if you are a medical student and you go on stage to show your data, you can work anywhere in the world.
But it's amazing how these, like, for example, this student, I think obviously he's an incredible specimen of a human being. But besides having to deal with learning medicine and all of that, how would you encourage students to do this research outside their studies, outside their like?
You know, one thing I've realized when I went to America, like UK a bit more relaxed, but America is like, you know, they are even working on Sundays, you know. So you need to, if you want, you know, everybody's asking, how do I work abroad? How do I study there? Is really down to hard work, you know. I mean, because when you are competing with your peers, if you want to work in America, you're competing with the Americans, and Americans they're so driven, you know. So
oh yes,
yeah, so you have to be driven. You cannot say what I mean. You know, graduating with good grades is just not going to cut it. So you have to, like I said, you have to. And the good news is that you just need to do. You don't have to work so hard all your life. I mean, you just need to know the timing. So before you graduate, you publish something that will stand you good for 2-3 years. You know, so timing is as important as hard work. If you work hard all the time, and you're not going to enjoy anything in life. But if you know how to time your hard work, okay, now it's 3 years, let's do it. I have a friend, Joshua, he's Singaporean, and he used to be with me in Singapore, in Washington. When he has to publish a paper, he's got all the data there. He says in 5 days, he'll just be in his desk, crunching data, writing. In 5 days, he can publish a paper to publish. So in that 5 days, he's super focused, don't disturb me guy. But the next 1 month, he's just relaxed. So if you can know how to time your hard work, that's the best. So don't work hard all the time. Work hard when you need to work hard. Time it rightly. So that means like maybe if you want to work there, because I understand in Malaysia now there's quite a difficulty to get jobs. So okay, fine. You as a medical student, you talk to your professor. Said, look, Doctor Saya, I want to check your data about lung cancer the last 5 years, and I want to see is there any correlation between vaping and cancer. Then you publish this data in an international journal, and maybe if you're lucky, the international journal will be interested and they will cite your data. And can you imagine when you go for an interview for a job in Australia and say, oh yes, my paper was here and here and here, they'll be so impressed of your maturity, of you know, your insight things. But so grades is one part, publication is one part, and you need to have a balanced personality, you know, I mean, have interest in outside world, have interest in like whatever. I mean, like I was a sports secretary in Manchester, so I used to play a lot of sports also. So I think you need to have all this to make you a more wholesome person.
All right. Thank you very much. Okay, so from Amni, what is the most challenging part when you become a cardiologist?
What's the most challenging part?
I don't know. Can you find one?
You know, I mean, I don't know. I mean, you know, but, you know, like I said, there are good days, there are bad days. And so you need to have both, you know. You keep the good days high for your bad days, you know. So that's how you keep saying all this. Because there'll be good days, there'll be bad days, there'll be days that, you know, we're all humans, we make mistakes, or we can't save everybody, you know. So sometimes as a doctor, you get used to all this, but there are days where it affects you a little bit. Maybe you make a mistake and you were tired. So, you know, there are times. So that's why you need to be a balance, and of course, religion also helps you to keep you sane, and so all of this keeps you good, you know, and that's the same for all fields of medicine.
I see. So practically, you also need to discover your own coping mechanisms lah kan? Okay, so a comment from FB, a lovely comment. This guy never failed to inspire me since my typing days. I'm listening to him now, hoping that it's not too late for me to become a cardiologist. This is from Izzat Raya. Okay, and then next, from Ain. Universiti mana yang sediakan path untuk menjadi cardiologist? I guess in specialization.
So cardiology, if you talk about specialization training, so there's KKM, so there's Ministry of Health. You apply to Ministry of Health. This is going to be, like I said, Sedang, Penang, Johor, Sabah, Sarawak. University-wise, I think Unimas or in Sarawak, PPUM, UITM, UKM, HUKM, I think HUSM, I'm not sure, but so there are quite a lot of university that, and also IJN. So IJN also provides training as well. Like I said, I mean all of this when you typically go on an interview for a job, normally you have about 5 people apply for a job as per you, So you need to be as competitive because you have 5 other people applying for that one post that you are applying for. So that's why keep your CV active in many aspects. Keep it active in your sports, your grades, and your academic excellence.
All right. Okay, a notice to the audience in general from FB and also in Zoom. If we could, we have to cap the questions now because of course Doctor also needs to go back home. All right, so from Mr. Taufik again, on a more serious note, with the advancement of telemedicine and the upcoming 5G technology, how different will your world and daily life look like? Oh, that's interesting. Yeah, that's very interesting.
I don't know. I mean, like 5G. So I don't know what 5G means, but telemedicine, yeah, it's still difficult because you might be able to follow up with patients, but for new cases, it's not so easy in the field of medicine because you have to examine patients. But for follow-ups, I think it's okay. So we do have patients from Indonesia that does some telemedicine with us. But you're right, it's a very good question because it feels like the world's going to change somewhat with how we connect very well with webinar world. But I don't know yet because in especially cardiology, it's such a hands-on field. But I think that the technology in diagnosing patients like MRI, CT will get better and better. There are some robotic surgeries nowadays as well. So things are moving very fast. And sometimes, even in cardiology, we feel that the technology advanced so fast that we are trying to understand how to use the technology. So, so we are still trying to find a way how to use the technology in the medical field as well.
Okay, just now you said you're not quite sure what 5G is, right? But if I understand correctly, it's practically like very fast internet in terms where you transfer data, you obtain data. It's very real time. So would that be any change to your answer just now?
Yeah, I mean, like, because of robotic surgery, right? I mean, it's technically possible that we can do operations in Malaysia for someone in India, because they got the machine there and we will do it real time because it doesn't matter if you're outside the room or in Malaysia. So you can actually do surgery remotely. So that's something that may happen. That's something I just thought out of my head, but I think it's possible. So even in cardiology, there are robotic surgery that can be done remotely as well. So I think, yeah, I mean, things will change now.
Okay, so we have a question from Ain. I think she's looking for some motivation. She's in Sekolah Menengah. She's still in Sekolah Menengah. Are you really good in biology when in Sekolah Menengah?
Yeah. No, my answer is no. But you need to know the timing. So when there are times you need to really work hard. So I was okay. I mean, I'm good enough in biology or in my exams to get a scholarship at the time. but I'm not the smartest, because when you go to typing, suddenly there are really smart people there that
Oh, yes.
when you come from your form 3, you think, oh, I'm very smart. Then you come to typing, like, oh my god, what's wrong? What happened to me? Like suddenly you are just
average.
average or below average sometimes. So yeah, so I think none of sometimes we don't have enough time. Sometimes we just learn because we need to learn for the exams and all that. But sometimes when you read the books, lecturers like Cikgu Masuria and all that, they make a huge difference, because some teacher just regurgitate and some just inspire you, and it's so great when you have really good teachers. So because what we see in the book that we learn and find it so boring, it's years of accumulation of knowledge. So if you really understand what they're trying to say, if you have the time, then banyak benda in there. It's really so much knowledge. So take your time. Not all of us are good. There are some people that's a late boomer that they might not be good at certain when they're younger, but they get better as they go. And we've seen a lot. We see even they terbalik when they were so good, and then now not so good. So it's take your time. If you put your effort in, you put your effort, and inshallah, then you will get better. So you just need to work hard, and not work hard. Know what you want to do, and hopefully it will make sense. Because sometimes it just clicks. Sometimes you like baca apa, and suddenly it just I understand. I understand this concept. So. And like I said, there are some teachers along the way when you're fortunate to get either in Malaysia or in international, where they inspire you. And they inspire you to seek more than what the book. You go back home, and because you have a wealth of knowledge on your internet, you go back home and do more research on it. Then your knowledge goes beyond the superficial level, and you get more interested. So that's where specialists are about. Or if you do PhD, your knowledge just goes beyond what is available, and you start to question what is available, and you take it a bit more forward. And if everybody does that, our knowledge in everything in science and our knowledge will improve a bit, so that we have a better understanding. So that's how it is now.
All right. Okay, so we have a question from FB, from Muhammad Shafiq Muhammad Razali. He's currently doing his cardiothoracic training in UITM. What is your best advice for a cardiothoracic trainee from a cardiologist point of view?
Wow. That's the first time a surgeon is asking a cardiologist my point of view. But he's got a good point. And the reason why he's asking this is because the line is a bit blur. There's no longer a typical surgeon, and there's no longer a typical cardiologist, because it's quite blur. Things that used to be a domain in cardiology is being shared by cardiothoracic, and the domain in cardiothoracic is being shared by cardiology, because we are doing things that were purely a surgical view. So I can tell you a story. When I was in Brompton, the surgeon, final year surgeon, so the surgeon, they have MRCS. I've got MRCP. So P is physician, S is surgeon. He's got both. He's got MRCS and MRCP. So I was like, wow, this guy memang tabik lah, like terror, So if you really want to know my view, if you can be both a cardiothoracic and a cardiologist, then it makes you in good state, because, like I said, things are getting a bit blur between surgeons and physicians.
All right. Okay, so from Taka Niswaran, doctor, do we have to do MBBS first and then only we have to take cardiology course, is it?
Well, MBBS is a medical school. So you need to become a doctor, become cardiology. Tak boleh lah become cardiologist, tak doctor, then you like, tak boleh.
You have to specialize after you become a doctor, right?
Yes, but yeah, of course. Doctor is like your basic requirement, but you can do cardiology as part of your training. So, before you get your MBBS, you will do obstetrics, neurology, cardiology as your rotation. So you will learn everything. But you can slowly, like, if you like something like surgery, you like something like cancer, then you start to do some research on that field, attach yourself to do some fellowship in that field. I've got a student, he's in our IMU first year, and he was attached to me for 2 weeks in Gleneagles. So basically, he was attached to me for 2 weeks, and he saw me doing cases in my cardiology. He wants to become a neurosurgeon, so he saw a neurosurgical operation as well. So you can go beyond. You can go beyond your 9 to 5. You can go beyond your school syllabus, because when you go beyond that, your CV becomes more colorful.
All right, so I hope that answers your question. Okay, so from Sophie just now, because I guess I wasn't quite clear on the question, but how did you get the opportunity to go to USA, France, Japan, Singapore, practically your research presentations? So do the procedures and join those events? Like, were you sent by the hospital, or did you have connections?
International, no connection lah. So, but but of course, okay. Let's see. My fellowship, there was 2 options for me. I could have gone back to. There was a place for me in Hammersmith in London. So, and that one I no connection. That one I went to the hospital during my holidays. I spoke to the head of the guy there for intervention, Dr. Iqbal, and I went to the cath lab, and he said, yeah, I'm free to join him for 1 year. In America, America is okay. I mean, see, America, they like to have people who wants to do research, because it's a lot of work and it's very lowly paid. So if you're keen to do so, you can. I mean, that one is through some connection with IGN to America, but I also know I mean, I'm sure you know somebody who works in America or in UK or something, and you just said, look, can I go to your hospital for 2 weeks? And when you're in the hospital, to do research, you don't have to, there's no license, you just have to help them get their data, do some data research, help to do some publication. It's all free. I mean, so when you show interest, they will give you more things to do. You see, so yeah, there are a lot of, and when you go to America as well, you see there are so many people around the world there. You probably see Malaysians there, Singaporeans and all that, because it's a land of opportunity, because they want people to do it. So, and it's also the same as Malaysia. So I think if there's so many data here right now. There's so many data that if you can collect the data in an organized manner and publish something in our local data, then because you can't go to America and say like, I do not know what to do, but I want to publish something. Then it's like, no time for you now. But you can start doing this in your local data first, so that once you have this core skill, you can do statistics online. There's a lot of doctors doing this MPH, something, some statistical thing, and doctors love it because they don't have it. So when you start doing it in Malaysia, and then when you go abroad and you say like, look, I've done this, give me your data, I publish it for you, they will love you. So start locally first. Don't be super ambitious like, I want to go to America and I want to do something. You start locally first. You do your own local data, collect your data. dengue. There are things here that are so unique that they don't see it there. We have like rheumatic heart disease. We have all these things that are so exotic to people in abroad, that our Nipah virus and all that. So collect our local data. They might even invite you to talk there. So that's one aspect. My talks in Paris and all that, as you go into your subspecialties, number one, they will invite you if they think that you're so-called a subject matter expert. They will invite you to talk. Or there are times when they invite you to present cases. So if you submit your cases or submit your data, so say that if you have dengue and all that, you send a correlation of dengue fever and heart disease. They will love it, because like they don't know what dengue fever is. So they will say, oh, what is this? So then they will invite you to give a small talk, 5 minutes talk on your abstract. So that's how you get, and once you're into the circuit, I call it, when you get to know people there, then they will invite you more and more, and suddenly it becomes, I used to travel every month abroad and ask my wife. So after work, I would just go fly off somewhere, and because I do cases as well, they invite me to do cases there. So that's fun. So the world becomes a very small place. The world is a very small place because everything is possible.
All right. From Jared, how did the chance come up for you to do research during your medical school years, not after you were a graduate?
See, every doctor in university, they see, I mean, as you get older, research is not what's the word? Research is not forced upon you. So every doctor in their professional field, they is their own interest. It's like, you know, oh, I've been doing this work all these years, and I've always think that A plus B equals C. So there's always questions when we practice how to make it better, how to reduce mortality. So professors have always got research ideas in their mind, but they don't have time. You as a medical student have time. You have too much time. You know, so if you can show your interest and say like, look, can I do this research on something? They will be so happy to guide you. So of course, some people are not so open, but there'll be a lot of more professors that are very open for you to do research. You know, in IGN, we have a wealth of data, and some of them are very good. They come and they publish and they present in our meetings and all that. So the data are there. You just need to find a way to to seek some professor who shares your interest, and they will be more than happy to have you to do their research.
Would you like to drink some water first?
Yeah, yeah.
All right. Okay, so I think you've already answered this question, but maybe this person was not able to come in at the time. What inspired you to become a doctor and specialize in cardiology? Like, for example, just now you stated about how you had 3 options, right? Which was neurology, cardiology, and also A&E. But how did you come upon the idea of, oh, okay, cardiology is interesting, maybe I might pursue it? I think from that perspective.
So I think that kind of interest is when you do your medical school rotation, because you will go through some rotation and you will find that in your 4 months or 6 months in this field, you feel like, oh, I kind of enjoy this, you know. Of course, it will change. You know, I noticed also after one rotation is good, then you change to another one. Oh, this is also good. This is also good. This is also good. You know, so so I think you will tend to have a few interests now, of course, 3 to 4 interests. So then you have to match these 4 with your ability also. And you have to match this with your personality as well, because if you don't like to be on call, I mean, for me, 3 in the morning, they call me, I say, okay, heart attack, okay, put on the phone, drive to work, do the case. And I go back home, I can sleep, you know. But some people, they cannot do that. They cannot wake up at 3 in the morning, they cannot sleep back again and all that. So you have to match your interests with your ability, your personality, and also the opportunity. There are times when you really want to do something, but there are 20 people already there, and you know they've done, I don't know, something that they, so sometimes you have to match all this, like you have to balance, because you know when I was applying for cardiology job in UK, there are times I said, Allah, maybe I just do something else, like, you know, fed up with it. Really. So like, because there are sometimes opening like in other fields, you know, like cardiology in UK is very difficult, and I wanted to do it in London, so argy difficult. But you know, so you have to match all this, like you have to match all these aspects of things, and I think lastly is luck. So you know, sometimes you go for interview, and then the doctor is Malaysian. Alamak, senangnya, thank God. So, betul. I know this Dr. T.P. Chua. Anyway, so like, you know, so like, alamak, so he's Malaysian. So sometimes you are lucky also. I mean, you know, sometimes, but the harder you try, the luckier you become. So, I mean, of course, after my 50 applications, I get something, you know, so you just have to try, keep on trying. But there, like I said, if you keep on trying, there's always something that you can do.
Very true. All right. This will be the last question from Khairunisa. Yes, you should be happy. Despite studying hard to become a cardiologist, what about the cost that one would spend during the 9 years in college? Oh, okay. I think she wants an accumulation, like an estimation maybe of the cost.
Okay, well, the good news is that you start earning when you graduate. So, so it's of course A levels or STPM. You know, there's some cost. Medical school is a bit expensive. I think locally, if you get into government, it's okay. If you get to private, you're mahal sikit. But the good news is that once you graduate, you start earning. Okay, so how much did I earn in UK? As a houseman, I can't remember, about £1,005 a month. But they provide you accommodation as well. And then after second, third year, maybe about, I can't remember, about £2,000 or something, 2,000 to £2,500 a month. But you have to remember also the tax in UK is very high, it's about 45% or something.
So the expats, right?
Yeah, but yeah, so taxes are very high. But the good news is that in UK, they do have the doctor punya accommodation, very basic. Because sometimes you look at Malaysia and compared to UK is like so lousy, you know. I mean, the accommodation is really, you know, like it's so simple, so basic. One almari and one katil, you know, which would never be accepted in Malaysia. So, but that's how we used to live life in UK. And I also used to work in UK when I was a student. So what did I do? I worked in Pizza Hut. I worked as a nurse. I was a nurse on Sundays because they paid like £7 an hour. So on Sunday, I used to work as a nurse kat sana, when I was a 4th year medical student, so I can afford to buy a car. So there's always a way for you to do things. There's always a way for you to earn money also. I used to do a lot of stuff. I used to earn the money and go for holidays also.
It's very inspiring because like you have the will to obtain something. And especially we can see that from your very high drive to do research. All right, so I guess since we have 4 more minutes to 10:30 and we've already exceeded a lot by the time that was, you know, prescribed for this talk. So we would like to say thank you very much, Dr. Al-Fazir, for joining us today, for being our special guest on this career talk. And of course, we would like to say thank you very much for those who are watching through FB Live and also in this Zoom as well. And for asking the very engaging questions that you have asked. Without further ado, I would like to say thank you and Assalamualaikum.
Thank you. Take care.
You too. I hope you have a good rest tonight.
Bye.
Thank you, Doctor.
Okay.
Thank you so much.
Good night.
Thank you. From me too.
Yeah. Hey,
Cikgu.
cikgu punya anak pun medical school lah?
Yes.
Kat mana?
MSU.
Oh, kat Shah Alam, near my house.
Yeah.
Okay
So
lah.
he's interested. So
I tell you what, he ask him to come to see me in CVSKL or CVSKL one day lah. I can talk to him.
Oh, that's good. Thank you. Thank you.
Bye.
I will. Yes.
Kak Ma excited, Kak Ma?
Yeah.
I stay kat Bukit. I stay kat Bukit Julutong je lah. Nanti suruh datang ke rumah sekali.
Okay.
Dekat MSU tu.
Okay, insyaAllah. Nice to see you again.
Okay, yeah, nice to hear from you. Tak nampak lagi.
Okay. One day.
Okay, take care.
Bye.
Okay, bye-bye.
Thank you.
Yes, okay, bye-bye. Nak balik rumah, nak makan dinner.
Okay,
bye. Good night. Take care. Bye.
Thank you, Doctor. Take care. Okay, thank you, students. Thank you. May I stop the live now?
Yes, you can stop the live.
Okay.